I'm Julia. I'm a PA with the epilepsy team. I've been here at Children's Hospital for the last 7-ish years or so. My talk today is about VNS, so let me just pull up the slides. Okay. So I just want to start by talking a little bit about the statistics of epilepsy. And the epilepsy is pretty common. 1 in 10 people will have a seizure in their lifetime, and 1 in 26 people will go on to develop epilepsy and have multiple seizures. 2/3 of patients who have epilepsy usually respond well to medications, and seizures become controlled with maybe 1 medicine, maybe 2 medicines. And about 1/3 of patients have really difficult to treat epilepsy. So it doesn't respond well when we're trying to use medication. And in those cases, we usually have to do some further evaluation, workup to figure out what's going on and get more information. And then we can try other treatments beyond just treating with seizure medications. So some of the things we can do when medicines really aren't working well for seizures are epilepsy surgery, ketogenic diet, and neuromodulation. And we have a few different devices that we can use for neuromodulation. We have a vagus nerve stimulator, the VNS, a responsive neurostimulator, the RNS, and a deep brain stimulator, DBS. And they all work in a little bit of different ways. Epilepsy surgery really is the best treatment if a patient is a candidate for epilepsy surgery. It has the best chance of becoming seizure free. And if a patient has focal epilepsy, meaning that seizures are just coming from one area of the brain, usually epilepsy surgery would be the best treatment option. Ketogenic diet is a special diet that we use for seizures. Normally the brain uses sugar for energy, and that's broken down by actually eating in your diet carbohydrates and sugar. So what we do with the ketogenic diet is we switch the brain from using sugar for energy into using fat for energy. And what that does is that allows for seizure reduction. So it's a difficult diet to follow. It's not for everybody, but there are some genetic types of epilepsy that do respond really well to ketogenic diet, particularly if there's a GLUT1 abnormality. So why do we want to be so aggressive when we're trying to treat children with seizures? And it really comes down to the seizures. Continued seizures are impairing the brain development in children. And that's really their main job. They are supposed to go to school and learn, and they build on, everything that they've learned from the year before. And it's hard to progress and move forward when you're having a lot of seizures and you're missing school or you're missing pieces of your learning. It's difficult for you to progress and move on. And so we have found that if you have onset of epilepsy before you're 5 years old, you tend to have decreased IQs overall, which we want to do something about. So we want to treat seizures pretty aggressively when children are having them. So is VNS right for you or your child? So I think it's really important to discuss with your doctor if you've tried 2 medications and have continued to have seizures. Most of the time, seizures, like I said, 2/3 of the time, seizures become under good control with medication. And really the first or second medicine should be the one that works for you. If you are still having seizures, I think it's time for more evaluation. Another time it's right for you is if you're ready to try something different, try something new. If you are having a lot of side effects to your medications, it's hard for you to function in your daily life. You're very sleepy during the day, or your child's very sleepy during the day. All these things can, all these medications can have a lot of side effects causing problems. You can also, VNS is really good if you miss doses of medication, if you have a hard time remembering to take your medication, or if you are just even worried about missing doses of medications. There's some studies that show that even patients having one seizure a year is just as worrisome and stressful as patients who have multiple seizures, because you never know when that one seizure is going to be. And so you live your life, you know, a little bit differently. VNS is also a good option if you have a long recovery period after your seizures. So maybe you need to rest for several hours and take a nap after a seizure, and it's hard for you to get back to your regular activities. And so it's really impacting you. Every patient who has epilepsy that's difficult to control with medication should see an epileptologist, and they should have a comprehensive workup. So the workup for figuring out, you know, what's going on with your epilepsy should include recording seizures on video EEG monitoring. You also need a 3T brain MRI. Here we do a special series of protocol called a epilepsy protocol, where they're thinner cuts of the pictures on the brain MRI, and that can help show us if there's any structural abnormalities causing seizures. And then we also want to look at genetic testing. So a lot of times we can find answers on the cause of epilepsy, or we can find maybe a new medication would work better based on what type of genetic epilepsy you have. I know Dr. Holder talked a lot about genetic testing yesterday, so hopefully you were able to catch that lecture. So the VNS, the vagus nerve stimulator, is implanted device. It's similar to a pacemaker. It's in the left side of the chest, and it has a wire that wraps around the vagus nerve. It turns on and off all day, every day, to help prevent seizures and to help stop seizures. So we'll go over, I have a slide in a few minutes about the different ways that the device works. But pretty much there's either seizure prevention and seizure detection, and it works on both of those. So it's a good option. The stimulation to the vagus nerve is how it works, and it changes the way the brain, the chemistries of the brain. So it is thought to increase the seizure calming chemicals and decrease the seizure exciting chemicals. So this overall in turn decreases seizures, similar to the way a medication would decrease seizures. And most patients see an average reduction of seizures of 60 to 65%. A lot of times patients are able to have a reduction in seizures, which allows them to come off maybe one medicine that's been troublesome or some medication. So they just have overall better quality of life because they're on less medicine. So this is just a picture of how we are able to set up programming parameters in the device. There's a wand that talks to the device, the generator on the last page, this generator, through Bluetooth, and then it also talks to the tablet through Bluetooth. And then there's a lot of settings that we can set up in the device so that we can really customize it for the patient's seizures and really find the best settings that work for them. The surgery for the VNS is pretty painless. It's about an hour to an hour and a half under anesthesia for the surgery. You can come in and have it done one day and you don't have to stay overnight in the hospital. For the surgery to take place, they make 2 small incisions. One incision is going to be in a crease of the neck, and the other incision is going to be in the left upper chest area for the generator. The battery on the generator lasts about 4 to 8 years. It kind of depends a little bit on the settings. And another benefit is that it's not brain surgery. So it's a little bit easier of a surgery than opening up the skull. So the VNS works in 3 different ways. It works to prevent seizures by turning on and off all day, every day. And so that's this kind of standard mode. We set up a certain amount of time that it's on and a certain amount of time that it's off. And it just, runs through that cycle all day, every day. It also has a magnet that you can use if you are seeing a seizure. I think this provides a lot of comfort for patients and families to feel that they have something that they can do when they're seeing a seizure to help try to stop that seizure. So it's for seizure abortion, or it can either stop the seizure or shorten the seizure. So you'll swipe, you have a little magnet on a bracelet or on a clip, and it comes with the device, and you just wave the magnet over the device, and that really can help stop that seizure that you're seeing at that time. The newest models of VNS, the last 2 models, have a really awesome feature where it has almost a mini EKG machine inside. And so it's able to detect the heart rate, and it's able to then turn itself on, similar to swiping the magnet, when it senses a rapid rise in heart rate. So the rapid rise in heart rate is something that happens with a lot of seizures. And so it's a pretty good marker of seizure detection, and then it turns itself on. So we found that this works really well, especially if patients have seizures at night and somebody's not there to swipe the magnet for them while they're sleeping. It's able to detect that heart rate change and then turn itself on. Some of the benefits that we have of VNS, seizures usually reduce in frequency. They're shorter, they are less intense. I think overall, I have a lot of patients report that they have improved quality of life because their mood is better, their memory is better, attention is better, seizures are decreased. It doesn't have side effects like most medications do. So that's also another benefit. And if you're able to come off some medication because your seizures have decreased, then that's also helpful. It can also decrease the post-ictal time, which is the amount of time after a seizure it takes you to recover. So a lot of patients feel that they're able to return to their activities, after a few minutes instead of maybe an hour of having to rest. The VNS also decreases the risk of SUDEP, which is sudden unexpected death in epilepsy. And the way it does that, what I was saying with the last slide was that there's heart rate detection inside the device. And so it's able to detect changes in heart rate. It also can decrease your healthcare costs by decreasing how often you have to go to the ER, how often you're being admitted for long seizures or having to get treatment with rescue medications. Some of the newest features that we have in the most recent model, well, there's 2 models that have the heart rate detection and auto stim. But the newest model that we have, the Sentiva model, has day-night programming, which is pretty cool because we can set up a different set of settings during the day and a different set of settings during the night. So maybe patients only have seizures during the day or only have seizures at night, and that allows us to really maximize and find the right settings and tailor them to that patient and their seizures and their schedule. And then it also has scheduled programming, the newest model, the Sentiva model. And the scheduled programming is just basically we can tell the device, we want you to change to these settings on this day at this time, and set that up ahead of time when you're in clinic. So then you don't have to come back as frequently for programming. This has been really great during the pandemic because before we were seeing patients every 2 weeks for at least 5 visits or so to get their device programmed up to a good strength. And now we're able to see them maybe once or twice and have all those setting changes happen at home. And they're not having to enter the world every 2 weeks and come into a hospital. There can be some side effects with the device. And some of the things that we can see, there can be a little bit of cough, and mostly that's when the device turns on. Similarly, your voice can have kind of a vibratory quality, or you can sound a little hoarse, and that's typically when the device is on. You can have like a throat sensation. Kids who can tell me what they're feeling when the device turns on have said there's a tickle in their throat, or they feel bubbles in their throat, something like that. And then another pretty rare side effect, I've only seen this with a few patients, is shortness of breath. And usually that's with activity, and that's with the heart rate detection. And we can usually overcome those with changes in settings. And all of these side effects typically improve over time. So within a few months, they're really not even noticing it turn on anymore, or it's not causing the same vibratory vocal effects. All right, so does anyone have any questions? I think I saw 2 questions in the chat. Let me just pull that up really quick. Okay, the first question, is there any harm if the magnet is used and there really wasn't a seizure happening? No, there is no harm in the magnet being used. If you're not sure, if you're thinking that you're going to have a seizure, or your child looks like they're about to have a seizure, you can swipe the magnet and that may stop it from progressing into a bigger seizure. Also, the device works by turning on, so delivering more therapy by swiping the magnet is not going to be harmful. It is not going to cause any problems. Also, when we're doing really define some of the best settings for a patient, we ask the family to swipe the magnet for seizures to create a little seizure log for us. And we're able to go back and look at the heart rate sensing data and there's timestamps in the device for that. So we can see if the heart rate changed and turned the device on at the time that you saw the seizure. So swiping the magnet is helpful for programming as well. There can be, a lot of times the magnet is set a little bit higher than the regular cycling settings. And that's really kind of a historical thing that we've done, just because patients kind of want to feel it turn on, and it's a little bit different than just what's happening all day, every day. I think that gives patients the comfort of knowing they swiped it, it turned on, and it's working. But that's really the main reason. I know some parents have expressed that it's frustrating. You can't tell that that when you swipe the magnet that it's turned on. Some parents can tell because their child maybe does have a little vibratory sound to their voice when it's running, so they can hear it. But not all patients can tell their parents when it's running. That's a good question. Sorry, I went off on a little bit of a tangent. Okay, the next question is the VNS effective for absence seizures? I would say yes, the VNS is very effective for absence seizures. We do have some settings that probably work a little better than others when you have generalized epilepsy or absence seizures. And with absence seizures, a lot of times the heart rate doesn't increase. They're too short for the tachycardia detection, the heart rate detection to catch them. So we do use a little bit of different settings for absence seizures, but it does work very well for them. How well does VNS work with spasms? VNS can work well with spasms. I have a few patients in my clinic who have infantile spasms when they were diagnosed and have gotten their seizures under control with the VNS. So I do think that it's an option. And then the next question says, VNS works for mood disorder, how? So it's unclear exactly how the VNS works for mood disorder, but there are studies right now studying it for depression. I think the reason it works is because it's changing those chemical balances in the brain, and that's why it's able to improve mood. Are there any other questions? We still have some time. I went through everything kind of quickly. Okay, the next question is, are there any new VNS models? There are, I'm sure, working on new VNS models, but the model that we're using right now, the newest one that's out and available, is called the Sentiva. The model before was called the Aspire. And so probably those two are the ones that are mostly implanted. I haven't heard anything about anything newer coming out, and it hasn't been too long since the Sentiva came out. What is the youngest age someone can get a VNS? The device is pretty small. I would say our youngest patient was probably, that we've implanted here at Children's Hospital, was maybe around 2 or less years old. And I think really it's just a size. The size of the generator is really what would limit maybe implanting someone so small. So the newest Sentiva generator is a very small, small size. So I think it would be able to be implanted pretty young. Okay. Also, are there any new features? So the newest features that we have is the heart rate detection with the auto stim, where it turns itself on, basically swiping its own magnet. We have the day-night programming, where we can have a different settings during the day and different settings at night. There's also prone detection in the device and low heart rate detection. So those are newer features that we're able to use. I think newer than that, I'm not aware of any new things that the company is working on creating. Do you know about what percentage of epilepsy patients get a VNS? That is a good question. I'm not quite sure how many get a VNS. I would say 2/3 of the patients usually are well controlled with medicine, so they don't actually need to investigate for surgical workup. And then 1/3 of patients probably go through a surgical workup. I would say maybe half of patients that we work up for epilepsy surgery are a candidate for that. So the other half, I think, are a good candidate for VNS or diet, depending on what type of seizures you're having, and especially if you don't have focal seizures and you have generalized seizures, then you're not a candidate for epilepsy surgery. Okay, the next question. What percentage of VNS recipients achieve seizure freedom, and how long does it typically take them to achieve seizure freedom after VNS is implanted? I would say there's a small percentage of patients who actually become seizure free with the VNS, maybe 15% or less who are implanted. I will say, though, that a lot of patients do have such a good reduction in seizures that they're able to come down on medications, which improves their quality of life. And then how long does it typically take them to achieve seizure freedom after it's implanted? So the VNS takes time to work, and we tell all of our patients that it's going to take about at least 6 months to really see a difference in seizures and really know how well it's working. I think it works better the longer it's in. So if the VNS has been in for a year, it works better than it worked at 6 months. If it's been in for 2 years, it works better than it worked at 1 year. So it is a time investment, and we've had some patients become seizure free just after, I would say, maybe a year of having the VNS. What percentage stay on meds? There are quite a few patients who still stay on at least some medication, even though they have the VNS, but it also depends on how many medications they were on when they started, like when they first had the VNS implanted, and then also what kind of epilepsy they have and how bad seizures are. So we have a lot of patients here at Children's Hospital who really are on very many medications. They're maybe on every med. They tried every med, and they're still on maybe 6 medications. So, and they're, having a lot of seizures. Those patients probably are going to continue to stay on medications, but hopefully we can reduce it a little bit and get them down to a few meds or 1 med. The percentage that stay on meds, I would say, I'm trying to think about it, maybe 80%, at least of what I've seen in my patient population. I'm not sure if the company has or any studies have actually looked at that, how many patients can actually come all the way off all their medications. So I don't have that data for you. What is involved when the battery dies? So when the battery dies, it's a very simple surgery to have the battery reimplanted. So the whole generator is switched out. Let me show you what I'll go back to the screen with the generator. So there'll be one incision in the chest and where the generator is, and the generator is removed, the wire's unplugged, and then you'll get the new generator, whatever is the new one that's out, the updated one, and then that one will be implanted. The wires will then be plugged into the new generator and it'll be closed up. So it's about an hour of surgery outpatient. And at least that's how we do it here. At what point do you suggest a child get a VNS? I think it's worth discussing if VNS is a good option for the patient if they have tried 2 medications and are not seizure free. And by trying 2 medications, that doesn't necessarily mean that you're on both of them at the same time, but that you at least tried 2 medications and went to a therapeutic dose of the medication that you tolerated going up to a dose that should have worked for seizures and still have continued seizures. Are there any other questions? So in summary, I think if you've tried 2 medications and seizures are not well controlled, you should see the epileptologist for evaluation. Other treatments such as epilepsy surgery, ketogenic diet, or neuromodulation with any of the 3 devices may work well when medications do not. And the VNS can decrease seizure frequency, severity, length, and improve your recovery time after seizure. So it's a good treatment option. All right. Well, thank you for learning a little bit more about VNS.